Hi, this is Dr. Hobbs. Today we're going to talk about excess emotion, stress, inflammation, low blood sugar, adrenal fatigue, overtraining, infection, and how these things contribute to adrenal stress, fatigue, your health overall, what you can do to prevent it, and how you can correct it if you've already got it. So let's get started. So we look at the slide right in the middle, and we see adrenal stress. Release of epinephrine and cortisol. So epinephrine and cortisol are hormones that are released during stress of the adrenal gland. So what causes stress of the adrenal gland? Infection, excess emotion, overtraining, inflammation, which has all sorts of causes, and hypoglycemia, which is low blood sugar. So how do we determine if we have these problems? Well, inflammation, we measure the blood for a chemical called high sensitivity C-reactive protein. For infection, we check for white blood cell count. Excess emotion and overtraining, we look at your history. And low blood sugar, well, we measure your blood sugar, see if it's low. And the way the low blood sugar, hypoglycemia, relates to adrenal stress is the adrenal gland produces cortisol, which affects your liver, and that causes your liver to increase blood sugar, also to increase triglycerides and contribute to fatty liver. And that increased blood sugar, of course, causes high blood sugar or hyperglycemia, which causes your insulin to go up and your pancreas to release that insulin. And then that causes glucose to go into your muscles, liver, and fat. And that fat causes abdominal or visceral weight gain, especially with this chronic high cortisol contribution. So adrenal gland also, when it's long-term stress, long-term adrenal stress, causes adrenal fatigue, and then fatigue overall, and then that contributes back up to inflammation, because now you have decreased cortisol, which helps naturally control that inflammation. The abdominal or visceral fat also contributes to inflammation. We used to think that abdominal fat, or fat in general, was just a storage place for excess calories, and it is, but it's also an active organ, which causes increase in inflammation. And infection, of course, causes inflammation as well. Now, the adrenal gland also goes over and it increases the blood pressure, high blood pressure. It also affects blood flow. In some places it decreases, some places it increases, and that contributes to heart attack and stroke. So that's the picture for today. So now let's talk about some solutions. Well, conventional solutions involve medication. And so we're looking at right up here where infection is treated with antibiotics. And inflammation is treated with anti-inflammatories. And high blood pressure is, or in this case, decreased blood flow, contributing to clotting. So we give you anti-clotting medications. And for the heart, there are medications to decrease the rate of the heart and the force of the heart. And these are life-saving, but now they've become lifestyle medications for many people instead of just life-saving interventions. So, what can you do naturally? There are a number of natural approaches you can take. And these are life-saving as well, but they're more long-term and slow to work, but they have only beneficial side effects when done right. So we have our little Play-Doh can with all sorts of diet, activity, supplementation, and then internal environment. So in this case, I've listed almost all of them for interventions for infection, excess emotion, overtraining, ultimately sources or solutions for the adrenal stress overall. So number 2, nutrient-dense foods. Number 3, quality proteins and fats. So I'll give you a little idea what some of these do. So nutrient-dense foods obviously give us lots of nutrients, including antioxidants, which help with that inflammation. Essential fatty acids, which help balance the inflammation. So most people have an excess of omega-6, and so this gives us more omega-3s if we have a proper diet. Also excess emotion. So in this case, we're down to number 7 and number 5 and number 6. So proper sleep improves our ability to handle stress, recover from it. Exercise also is super good for this. Number 1 solution for mild to moderate depression is moderate exercise. It's the first recommended intervention. And then for emotion, you have cognitive behavioral therapy, prayer, meditation. These are ways to directly intervene into excess or negative emotion. And then nutrients from nutrient-dense foods, as well as quality proteins and fats. These help with overtraining and emotion, help you to handle an excess load. All right, now we're dealing with COVID-19, and there's a lot of people who are dealing with a lot of excess of emotion, and often they'll turn to things that are not quality as far as foods, and that makes it even harder on them. So this is the time to really dig down and do what you can to eat well. Okay, so there's a number of different places these improve the body. So adrenal stress directly. The adrenal gland needs a lot of B vitamins to function properly, and good food provides that. Mushrooms are actually an excellent source of B vitamins. Inflammation, we talked about that already, and talked about specifically the adrenal gland. High blood sugar, so nutrients, just a good diet, of course. This is more glycemic regulated diet, or low glycemic diet will help with this. Specifically to the muscle, so here we're talking about chromium to provide nutrients, to provide increased insulin sensitivity. And then abdominal weight gain. Here we're looking at muscle mass and exercise. All right, so those are solutions. Take this, apply it, look over it again so you can understand a little better. I know we went pretty fast, but I hope this is helpful. This is Dr. Hobbs from Synergy Chiropractic and Natural Health, signing off. Hope you have a great day. May God bless you.